Well, good afternoon, everybody. Thank you so much for joining our webinar today. We're going to be talking about the Colorado All-Payer Claims Database as a resource for biosciences organizations. So we're very excited to have you guys join us today. My name is Carrie Frank, and I am the Vice President of Communication and Marketing here at CIVIC, which is the Center for Improving Value in Healthcare. And we're going to be talking about this incredible state-based resource today. Just a little housekeeping before we get going here. All lines are going to be muted today, but you can definitely interrupt me with the chat box. So please, as I'm going through, if you have questions, I will try to answer those as I go along. Some I may save for the end. We will have a formal Q&A at the end that you can type in your questions as well. But feel free to type chat box questions throughout. We are recording this webinar, and we will provide a link to not only the recording of the webinar, but also the slides that I'm showing today. So look for that in your inbox after the webinar shortly within the next week or so. So today I'm going to go over just who we are as an organization, the Center for Improving Value in Healthcare, what the Colorado All-Payer Claims Database is, how it can be used, some use cases of how it is being used by organizations similar to those of you out there in the audience, and then also ways that you can access the data, how we provide the information in both public and non-public ways, and then we'll take time for questions and answers. So in case you are unfamiliar with who we are, CIVIC is a nonprofit organization. We are, mission-oriented as a nonprofit. We strive to empower individuals, communities, and organizations. And the way we do that is through collaborative support services and healthcare information. And everything we do is to advance the triple aim, which is better health, better care, and lower cost. Key facts about our organization, where we pride ourselves on being independent and objective. And again, we're a nonprofit organization. We'll talk a little bit more about our administration of the APCD in just a second, but who we serve is really change agents across all aspects of healthcare. And the consumer is really in the middle of that circle, and that's on purpose, because everything that we do, with individuals, communities, and organizations is really focused on making healthcare more affordable and accessible for consumers. So we work with hospitals and clinicians and employer groups, government agencies and state agencies, researchers, digital health plans, nonprofits, really anyone who touches the patient's lives. So we are the administrator of the All-Payer Claims Database, and we'll talk about Colorado's specific APCD here in just a second. But just in general, in case you're unfamiliar with what APCDs are, and they're large databases that typically include medical, dental, pharmacy information, and that's data collected from both private and public payers. That's where the all comes from. So Medicare, Medicaid on the public side, and then private side, more of the commercial payers, Anthem, Humana, et cetera. Advantages that APCDs have over a single payer database, or what you might have run into as a population-based database, includes that we have all that historic information on individuals, regardless of what kind of insurance coverage type they've had. I know we're going through at CIVIC, some switches, and since I've been here for 10 years, I think we've switched health plans like 3 or 4 times. And that happens, and people go on and off of Medicaid and Medicare and things like that. So no matter where you got coverage from, we can track the patient as individuals. Also across any type of care setting. So it doesn't matter if you went to a hospital, it doesn't matter if you went to an outpatient clinic, it doesn't matter if you had a telehealth visit, we can track that data. And then also it's, again, from most, or if not all, insurance companies in the state. I'll talk to you about Colorado's makeup here in a minute. But the really important information that comes out of that is the demographic information about the types of patients, diagnostic information. We collect procedural and reimbursement information that talks about what was paid for, not only by the health insurance plan, but what the patient was responsible for. And this is really information that's useful in a number of ways. And I'm going to talk a lot about the different ways it's being used, but for policy, research, clinical performance, or you name it, we were surprised, and we are continually shocked and awed at all of the cool use cases that come out of the data for APCDs. So this is what it looks like on the national level. Currently, about 18 states have some form of an APCD. And when you see an APCD, you've seen one APCD. They are all very different. Colorado's is unique, and we'll talk about how ours is unique. But we have been at this now for about 10 years. Actually, we just had our 10-year anniversary. But the 6 critical functions of an APCD are reporting on healthcare spending, utilization, and performance. A lot of work at the policy and regulatory arena, informing regulation and policy, informing not only the state agencies, but also the public about healthcare prices and policy, enabling people to shop for care, enabling value-based purchasing and healthcare improvement, supporting public health monitoring and improvement on population-based health, and then providing reliable data for healthcare research and evaluation. So this is the history of the Colorado APCD. As I mentioned, we just had our 10-year anniversary of actually being implemented and up and running, but we were the CO APCD in and of itself was recommended in 2008 by the Blue Ribbon Commission for Healthcare Reform. And then it was signed into legislation in 2010. And that's important because not all APCDs are actually legislatively mandated across the nation. Ours is. And so the health insurance payers are required to submit data to the Colorado All-Payer Claims Database. And in 2010, we were designated the administrator by our Healthcare Policy and Financing Department, which is our Medicaid department here in Colorado. And then we started building the APCD, and in 2012, it went live for the first time. So I'm not going to go over all the enhancements we've made since then, but we've been, adding more and more data. We've been increasing the quality and the completeness of the data. We've been providing more and more public information since that time, and really enhancing the utilization and the effectiveness of the data within the APCD since then. So what gets submitted to the APCD? We get medical claims. So all of the typical things you might think of within the medical claims that we'll talk about here in a sec too. We get the information not only on what happened from the claim perspective on the medical side, but we also get all the professional claims, which is who provided the services. So all the doctor information and provider information. We also collect dental claims, which is unique. Not all APCDs collect dental claims. We also get all the pharmacy information. So all of these files come in separately to us. The pharmacy claims have all of the information on what drugs were picked up at the pharmacy, how much it costs, what the national drug code was. So lots of detailed information on pharmacy, and then eligibility files too. And that's important also, because eligibility tells us who has insurance, but who may not be using it. So even if you didn't have a claim in that month, we collect claims on a monthly basis, we still get an eligibility file for each individual who is covered. So that way we can tell who has insurance, and again, do that tracking. We can do also some information on whether or not people are using their insurance, which is also an important thing to keep track of. And then in addition to the monthly submissions, all of those things I just mentioned are monthly data submissions from the payers. We also get annual files from the payers for things that are non-claims based. So those are things like alternative payment models for things that happened outside of the traditional fee for service for where you're paying for each encounter. Those are kind of up and coming ways to pay for healthcare that we like to see more and more of, and we're keeping track of what that looks like here in Colorado. We also get drug rebate information, which shows how much the health insurance plans are getting back from the pharmaceutical companies in the form of a drug rebate. So we get all the amounts of payments up front through those pharmacy claims, but we don't have a view, or we didn't until we started collecting this information of what actually goes back to the payers in the form of drug rebates. So now we have that complete picture of what pharmacy costs look like. We're also getting new this year value-based pharmaceutical contracts, which is similar to those alternative payment models. It's a way to incentivize pharmacy value over volume. And then also we're collecting some new fields for the Prescription Drug Affordability Board that is a new board at the state level here in Colorado. So it's a very robust database. We have over 870 million claims. We're about to update with 2022 data. So that number is going to be closer to 900 million claims. We're closing in on a billion, which is exciting. And across the payers, again, Medicaid and Medicare, we get not only Medicare Advantage, but we get Medicare fee for service. And we have 36 commercial payers that submit data to us on a monthly basis. So very robust across many payer types. This is about 5 million, a little over 5 million claims, or 5 million lives per year that we collect data for. And that includes about 1 million of the self-insured employer lives. And we estimate we get about 50% of those. I'll talk more about why that's not 100% here in a second. But it represents, if you're looking at the medical coverage, just that medical claim piece that I was talking about, we estimate we have about 70% of the covered lives in Colorado. So very, very robust data set that gives you a great picture of the vast majority of Coloradans who have healthcare. And we have trend information from 2013 to present. We actually have data that goes back to 2009. If there is a need, we can access that information, but it's most robust from 2012 on. So things that we don't collect in the APCD and are unable to at this point in time, federal programs like the VA, TRICARE, and Indian Health Services, those lives are not in the database because of the federal regulations around that, although we're working very hard with the VA here and trying to figure out a way to overcome some of those challenges and incorporate the VA data in the APCD. Because of a federal Supreme Court ruling, we also can't mandate that ERISA-based self-insured employers who are paying for the healthcare directly, that they submit data, but we can get them on a voluntary basis. So we estimate we still have about 50% of the self-insured employer lives. Majority of those are not ERISA-based. So if it's a district or like a school district, those usually are not ERISA based. And so those claims still come in. We also don't get anything that wasn't paid for through a health insurer. So anybody who's uninsured, which we have luckily a very small percentage of people in Colorado who are uninsured, we don't collect anything from uninsured patients, and we can't get information that happened through self-pay. And then there's some supplemental information that where, you might have some Medicare and Medicaid dual coverage. We have most of that information, but not all of it is complete. So if you're ever wanting to know more about what's in the Colorado APCD, we do have a really, really cool interactive dashboard that's on our website at civic.org under the Get Data tab. And you can look at the database in a number of ways. You can look at, just how many people are covered, some of that data that I just shared with you, but you can also look at the trends over time in particular years. You can look by the actual payer type. So on the lower right-hand side, you can see that you can select a particular commercial payer. So if you want to look at Anthem's claims and see how many insured lives are coming in through them, You can look at it by the type of claim, medical, pharmacy, dental, lots of ways to look at it. We also have information on types of claims, so dental volume and behavioral health services, all sorts of cool information available there. We also want to talk about, how do you use it? So we have all this great data, but how do you use it? And I'm looking at some of these questions before I get going. We don't distinguish between behavior and payor. I see it written both ways. To answer your question, Lisa, ER and OR, I'm talking about health insurance payer, and I don't think it really matters. I don't know why sometimes it's written one way or the other. That's an interesting question. Do we get remit data for medical and professional claims? Jim, can you tell me what you mean by remit data? I'm not sure I'm familiar with that terminology. If you can explain what you mean by that, then I would be happy to answer that question. It's all the adjudicated claims. So it's anything that got paid for and actually went through the process of getting a claim paid for. But happy to, if you can explain what that means. I'm unfamiliar. So I'll move on here, but thank you guys for using that chat box. I need to be paying more attention. So what does it tell us? So it tells us who received care and why. So we have a member composite ID, again, that can track you over time, or patients over time and across years and across payers. We get the information on, age and gender, where the patient lives. So home residence, 3-digit zip. We have diagnostic information. So what happened when you went to the doctor, what were the diagnosis and procedure codes at the claim line level. Again, who provided the care and where. So we have also, in addition to a member composite ID, we have a provider composite ID, so we can track providers over time as well. At the NPI, which is the National Provider Index level, we also have 5-digit zip of where the provider is located, and then provider specialty and subspecialty. And then again, that payer code and line of business. So which insurance carrier paid for the care. Yes, all of that stuff. Remit data is the allowed amount, co-share or the copay insurance payment. Yes, that is actually a great transition, because I think we have the next slide. How much was paid? We get all of that data. So we get not only the information about what was charged, but what was the allowed amount. So what was actually the paid amount by the health insurance payer, and then what was the patient portion. So we get copay, co-insurance, deductible, and we're going to start collecting also premium information starting in this year for the first time. So a robust view of all of the payment transactions. We also have the coordination of benefit amount and a flag for that as well. And then we also, again, know the medications that were filled. So the pharmacy ID, we know where the pharmacy was and the name of the pharmacy. We have the drug name, dosage, and the days prescribed, as well as the date that was filled. And we can tie that back also to diagnoses and things, so that you can see if patients are actually using their medication appropriately and getting the right prescriptions. So common questions that the CO APCD addresses are why are healthcare costs increasing? So we can look at different types of services, inpatient hospital services, outpatient services, and categories underneath outpatient services. We have a rise in Colorado in outpatient, so we can kind of investigate, like, where is that happening? What types of services have the highest variation in payments? So looking at, knee replacements has about a $30,000 difference between the highest facility and the lowest facility in Colorado. So we can look at those types of things. We could look at healthcare in different regions. So you could evaluate, is costs more in a rural area versus an urban area. also look at whether people are using their healthcare for preventive services and annual exams and things that they should be doing, like screenings, breast cancer screening and colorectal cancer screening. Look at whether people are using their healthcare in general. A lot of people don't, and it's interesting to track. We have some data publicly available on the use of healthcare services in Colorado and whether people who have it are actually using it. And are they using it for their annual exams? And how does that differ by payer type? More Medicaid patients using their coverage or commercially covered patients. And are people picking up your prescriptions according to chronic care management protocols? As I mentioned, we can see, if you're diabetic and you have been prescribed insulin, are you using it? Are you getting it regularly according to what you might need to control your particular condition? And other kind of utilization questions as well, like is the ED being utilized as a source of care for non-urgent situations? We've done an analysis on potentially preventable ED visits, and there's a lot of money to be saved by not going to the ED for things like, earaches and things that you could hopefully wait and see a doctor in an outpatient setting for. And how do payments for the same service differ by setting and location? So there are, a lot of data that we've pulled that shows the hospital-based care versus, independent freestanding outpatient facilities for the exact same thing will save the healthcare system and patients and health plans a lot of money in the long run. So some very specific key aspects of the APCD here in Colorado is we take data intake and QC processes very seriously and have been building those and making those more robust over the last 10 years. So we're working really closely with the submitters to make sure that their data is uniform and it's according to national guidelines on the common data layout. So we're matching what some other states are doing so that we can start doing some, more robust multi-state work. And researchers can get data from multiple states and kind of do multi-state analysis. We also have patient data that spans all of those care settings that I mentioned, inpatient, outpatient. You can look at skilled nursing facilities, ambulatory surgery centers. Captures that longitudinal care information across individuals and product types. The demographic information, I should mention too, that we are doing a much better job than when we first started building the APCD at collecting race and ethnicity information, which is really critical to start to inform health equity analysis and show where we have opportunities to improve equity in healthcare. So that information is mandatory for payers to submit. And that really is important to start to be able to evaluate the impact of socioeconomic and racial factors on health equity. And we have geocoded the APCD, which means that we can also marry census tract level information where a patient lives in their community with social factors from census data and other data sources that can show, income level, education level, transportation issues, things like that have a huge impact on health equity. And we can marry that with data in the CO APCD. A few other ways that we're different, because we're an independent, objective, and nonprofit organization as the administrator, we have a lot more flexibility than a lot of other states that are managed outside of the state department. So some APCDs, they really don't use the data external to just state projects that they may be working on, but we really have that ability, and it's part of our mission to get that data out there. So not only in a public way, but also on a custom level as well. And that structure is really important to allow us to respond to things quickly, and we have greater flexibility in that. we have custom and standard analytics and data sets available, and we work with hundreds of different clients on an annual basis to do public reporting and custom reporting. We work really, really closely with all of our partners and clients to serve their needs. And we really are focused on turning data into actionable information. So we're proud of some of the testimonials that you see here. We really take pride in working directly with our partners and making sure we're getting them information as quickly as we can and as the highest quality possible and to meet their needs. Lisa has a question real quick. I'll jump in. Is there a federal overlay of data? Can you compare Colorado to NHANES, for example? There at the federal level, some of the things we can do because of the census tract level detail that we have built into the infrastructure of the APCD, we can bring in some of the like census tract data that I was mentioning. I'm not familiar with the acronym that you put out there, but we can do a lot of different things to match patients with other data sources. We do that a lot on our custom analysis, where we take an external data source from, the Colorado Department of Public Health and Environment, for example, or any other data source that's out there. We can do that patient matching, and we do that a lot to be able to do some comparisons with other data sets that are out there. So there's definitely a lot of ways we work with our partners to make sure that patient matching, we call it a finder file. We get that data from others and we marry it with the APCD to be able to do those kind of deeper analysis across multiple data sets, because we know the APCD isn't the end all be all, and there's a lot of information out there that you need to pull in, and a lot of our partners do stuff like that. So happy to work with you if you have a specific use case on that. So we've talked a lot about a lot of these types of ways to use the data. I think that I won't go into a lot of detail. Market analysis is one we haven't talked about. Planning and growth and trend opportunities. Health systems are also, often looking at the data for that to see, which patients are going outside of their community. Maybe they need to, develop a new service line, especially in rural areas. Tracking that patient migration has been important. Communities are using it for needs assessment. We've done a ton of emerging trends information related to COVID and telehealth and some of the things that have popped up because of COVID. Digital health tools. We work a lot with folks in the digital health community to help them build consumer-focused tools that are going to improve healthcare and lower costs. So there's a lot of different ways. I will show you just a couple of other use cases. As I mentioned, we work with hundreds and hundreds of what we call change agents who are boots on the ground doing incredible work. University of Colorado, Denver is one that we've worked with for several years. They married the APCD data with electronic health record data that they had to develop a statewide surveillance system of Coloradans with congenital heart defects. Nothing existed prior to them getting access to the claims data and looking at their data as well. And really what they were trying to do is determine what that prevalence of congenital heart defects was in Colorado, how that was different across the different regions of Colorado, looking at the relationship between people who had CHD and what their socioeconomic factors and health outcomes were. And then also looking at the burden of mental health conditions for patients with congenital heart defects. So that was a really cool project that I believe is still ongoing, and we provided several years of data to them, and that's a surveillance system that they're keeping up and running to be able to continually improve care for these patients. Another one was working with Brigham and Women's Hospital. We provided some historic data for them to estimate the occurrence and treatment and cost of skin cancer across the US. So this is one where they did marry not only APCD data, but they did capture some APCD data from other states and pulled in data from CMS, Centers for Medicare and Medicaid Services. And they were looking at just the economic impact of skin cancer in general across the US, looking at whether there was care and outcome variation between the different regions that they were looking at across the US. And then with the ultimate intent of identifying prevalence and treatment options and some best care practices. So that was another exciting one that we did fairly early on. When UC created, another question from Lisa, when UC created the congenital heart disease database, did they share back with Civic? They've presented that several times to us, and I'm happy to share the link of the recording. I believe we have a chat where they share more information with that database. We don't have direct access to the database, but they've shared lots of publications and data that they have collected, and we track all of that information on our website too. So if anybody's been published, we have that information in our change agent gallery on our website. So I'll grab the link for you, Lisa, for that one in particular, and we can share that with you. And the last one I want to mention is UCLA. We worked with them on a pharmacy related project, which I think was very potentially impactful for understanding the health effects of youths on psychotropic medications. And so these were looking at drugs for things like stimulants and antidepressant medications, antipsychotic medications, and specifically for youth, and studying the long-term health effects for kids who are on these types of medications, and really looking to understand like the impact and to ultimately provide better care and support to youth that were on these types of medications. So that was another really interesting one, using the pharmacy data that we collect. So some other just unique questions being answered, as I mentioned, we are learning every single year. I've been with Civic since before the database was even up and running. So I, as a communications person, was kind of making up, oh, we think it's going to be used for X, Y, and Z. And we definitely knew like providers would be able to use it. We knew we'd be able to provide information for consumers to shop. We had no idea some of the interesting use cases that we would encounter. One was in understanding what the impact of legalization of marijuana is on opioid use. So that was a really cool use case that we've provided data for. Several like environmental impact. So we've been working with several clients and partners on looking at the incidence of disease near refineries, and whether people living near refineries are actually having better or worse health outcomes than other parts of Colorado. Also looking at fracking and whether that people who are living around areas that are impacted by fracking, are they having different health outcomes? And we've also been working recently, when they just published, is a new eco-friendly neighborhood that they're building, and making sure that there's plenty of parks and access to recreation services. Does that impact health? And is mental health a risk factor for severe COVID? That was another exciting one that we worked with Trajectory Health to evaluate. Once COVID came out, one of the, there were a lot of factors that they said, predispose you to be impacted more severely by COVID. Mental health wasn't one of the original on the list, but using the CO APCD data, they were able to show that folks who had a prior mental health diagnosis were more likely to have a severe COVID-19 incident. So some really cool, thank you for sharing the change agent feature in the chat. Some very cool questions that are being answered. So I just wanted to make sure that I spent a few minutes to just helping you understand how you can access the information. So we look at the data in kind of two buckets: what we provide publicly, which is a whole slew of information. And that really is aimed to identify opportunities for improvement for communities and for policymakers and for researchers to use the public information, as well as our custom CO APCD process, which that's licensed data. And that it just is very dependent on, again, the questions that people come to us they're looking to answer specific questions, and we are happy to help you with that. Just a couple things on the public information. Everything's available at civic.org for free. Almost every single one of our analyses has an Excel data sheet with it that's downloadable for free, that you can look at the information and conduct additional analysis. Some of our big major reports that we have available are our Shop for Care tool. That's our consumer facing tool. It shows I mentioned the knee replacement, prices can be $30,000 different between the highest facility and the lowest facility. That's where you would go to find that information. We have other types of services, x-rays, imaging, any imaging services, and then more major procedures like having a baby or a C-section, bariatric services. All of those are available on our website, and you can look at what it costs at different types of facilities on a named hospital and facility basis. We have our community dashboard tool, which is what you're seeing the visual of right here, that has cost of care information per person per year, broken down by the health insurance plan and patient. It has quality information. So our diabetics getting their A1C, our people getting their breast cancer screening, rates, things like that. And then utilization and access measures. So well child visits and preventive care, annual visits, things like that. They're all available by payer, by year. So you can look at trend information as well as county level information and division of insurance region. So lots of ways to slice and dice that information. We also have what we call our affordability dashboard, which has a number of cool analysis that you can look at within it. A more detailed cost of care analysis that shows more of the outpatient services. We have drug rebate information on our affordability dashboard. We have low value care, which is kind of wasteful care that we don't necessarily want to be doing in Colorado because it's costly and it actually can cause harm to patients. We have information on alternative payment models and what those trends look like in Colorado, as well as commercial payments based on Medicare as a reference point. So lots of information on the affordability dashboard. We also have that insights dashboard that I showed you that shows you more about what's in the CO APCD. We have the telehealth services analysis that shows what has happened since COVID. Oh my gosh, telehealth spiked so much, but we're still seeing pretty high levels of telehealth services in Colorado, especially for mental health. And that's just like the tip of the iceberg. With the public data, we have a ton of different analysis that we call data bites that are more, topic specific on things like ED services for mental health that was just recently released. So take a peek around, and if you ever have questions on if there's something publicly available that you're looking for, please shoot us an email. My contact information is at the end here. If you can't find something and you're not sure if you're looking in the right spot, I'd be happy to help. But if there isn't something that you see on our public website that you're looking for, that's when we can help with our products and our licensing. So we offer a number of different types of reports. We have standard reports that we've already created that are, a number of different topics. As patient migration that I mentioned, we have a standard report that helps people see where patients are going throughout the state. We have standard reports, low value care and some other topics, but we can also create a custom report. So those can either be, Excel files or that, pinpoint a very specific topic and answer a very specific question that you're asking. or they can be an interactive report like the ones you'll see on our website, where it's in Tableau and you can create visualizations and filters and things like that. Those are very easy to use, our custom reports, and we are happy to help. And those are really nice for people who don't have analytic capacity within your organization, or if it's you doing it and you don't have time to do it and you say, I just want Civic to be able to produce that, then we can certainly do a custom report for you. And then we have data sets. So some people just say, we want to take an Excel data sheet and run with it. And we can do that on a custom basis, or we have multiple standard data sets already available. And those are incredible because they're quick turnaround. They're, fairly low cost in terms of, if you look at other data sets that are comparable out there and they cost a lot more money, we've been able to really get the price down so that we are serving as many people as we can. And those are all built on, we have a data element dictionary where you can see all the different data elements and kind of pick and choose if it's not our standard data set, if you want to customize that to very specific elements within the data warehouse, then we can customize those data sets for you as well. And all of our pricing is dependent on how complex the request is. Some of the standard reports and standard data sets are, more cost effective because they're already created, but we'd be happy to work with you. We also have a what's called the scholarship program, and if your organization meets particular aspects of the scholarship program, then there is some funding available as well. So we would be happy to talk to any of you guys that are interested in licensing data. But if you have any just general questions, here's our contact information. I can open it up for a little bit more Q&A, but we'd love to hear from you. We have just a general info email there, but my direct email is also there. My partner in crime, who is supposed to be here with me, Pete Sheehan, he wasn't able to attend, but he's manages all of the licensed information. So if you have questions specific to licensing data, then you can reach out to him. We also would love to connect with you guys on social media. We're available on multiple platforms. And then if you wanted to just get on our mailing list, so you see all the new public information that we have coming out, we have a newsletter and email blast when new stuff it's coming out, which is on a, probably every 2 weeks we roll out something new. We'd love for you to join our email list at civic.org. So I'd love to take more questions if anybody has additional questions. Oh, you're welcome. Thank you so much, Lisa, for joining. We're happy to host you guys and would love to continue to work with your community. And we are just now a member of the CBSA, so we're excited to be a part of this community. We'll be attending all of the events, and I'm sure you guys have met some of my colleagues, Eddie and Mason. I think they were able to get out to the last one, and we'll definitely be out and about and engaging with you guys. We're excited. So look forward to continuing to work with you guys. And yes, definitely reach out if you have any questions. And otherwise, I'll give you guys a little bit of time back in your day. Thanks, everybody.